Hi, it's Nick Lagos from Core Physio and Pilates Studios, and today we're going to tackle one of those things that comes up all the time in the treatment room. The question that we get from clients about what sort of pillow should I use. My answer is always, there are many different pillows and I can't tell you exactly the right one. So rather than tell you which pillow to use, what I'd like to show you today is kind of how to figure out the best posture so that you can determine if the pillow you're using is the right one. So to determine that, what we need to do is actually see the position of your spine in lying. Now we're going to have a little look at someone today lying down, but they're on a hard surface, and that surface really helps us to show you what's happening with their spine, but you're going to be doing that on your bed. So you're going to need to either put a mirror in front of you or get someone else in front or behind to kind of look at the contour and the different levels of your spine as you're lying down. And that's going to tell us what position your spine's in, because you're really aiming for the neutral spine position. Alright, so let's have a little look, and that'll kind of help us understand what we're talking about. So you can see here we've got Amber lying down, and we've put some tape along her back just so you can see that each one of these bits of tape kind of lines up with her spine. So we're trying to get an indication of where her spine is in space, and what we're aiming for is pretty much a straight line here. So we don't want the line to be curving downwards like that, and I'm accentuating just to make you understand the point, but we also don't want the line to be curving in the other direction, so upwards either. So obviously your bed is one factor and your pillow is the second, and you'd use the same method to determine if you're in a good position. You want the pillow or the bed to be coming up underneath you and supporting the areas where you need support. So that's kind of in this middle section here, and obviously under your neck. Okay, so today we're really specifically looking at the effect of the pillow. So what we've got here, the pillow we've actually got here, it's a latex pillow, so it's a natural material and it's got a curve in it. And these pillows come in different sizes normally, so we're able to get these pillows, and your physiotherapist would, in sort of a low size, a medium size or a high size. This one's a medium one, the one that we've got here. And you can see with the curve, we're putting that curve underneath the neck so that it's supporting the area where there's a space. And then the head is falling into the dip. Okay, so with that pillow, and this might be the wrong pillow for you, and that's the problem with pillows, is that finding the right one really requires you being able to use it and see where your spine is, and that sometimes is why it's actually really good to be able to do that with the physiotherapist. So you can see this pillow and the line of Amber's spine, and you can see looking at the line, she's pretty straight up the top here, and that's the perfect pillow for her. So that really is keeping her in a good position when she's lying on her side. Obviously, it is different when you're lying on your back, but we'll go through that at the end. If the pillow was too low, then what would happen is that at the top part of the spine, the head would tip down and the spine would start to sink down towards the bed. So let's just have a little look at that by taking the pillow away, which is the extreme version, I guess, of seeing the spine in that position without a pillow. Alright, so let's lift your head up and then, okay. So you can see in this position, we'll just move the hair out of the way, and you can see now the spine and the head is really starting to lean down. So that's going to put a lot of tension on this top part of the neck and really close the joints together on the bottom part of the neck, which is really going to put pressure on them. So you can see straight away that this would be really uncomfortable if you did this for too long, and most people wouldn't be able to accept sleeping on no pillow, especially for side sleepers. When you're a back sleeper, so if you're spending most of your time on your back, and that's not the most common is side, but if you are a back sleeper, then obviously having a thinner pillow actually works better. Yeah. Okay, so now let's put the pillow back. Okay, and what we see now, straight away, just look with Amber looking straight ahead, you can see her spine's returned back to that straight position, so we're starting to get a feel for what's good and what's not good. Obviously, if the pillow was too high, then the reverse is going to happen. So let's test that out and let's have a little look at what that does to Amber's spine. So we're going to put a pillow underneath. And I'll just move the hair out of it. Yeah. So now when we look at the spine, you can start to see that the head is really in this high position and the spine is really sinking down. So hopefully, you can see that by the levels of the tape and how the tape's really coming down here. A lot of people sleep with two pillows and they really prefer it. And I think if breathing is an issue for you, then often being more upright can actually work well. But often I think the 2 pillows thing, while it might work well for breathing, is not really good for your neck. So you really have to find a compromise there. And I would recommend to people to be looking at beds that actually are slightly on a tilt or raised, rather than trying to prop themselves up with more pillows. Mainly because, you know, you're really only propping up your head and putting a lot of pressure again on the joints at the top and really stretching out the muscles and tissues underneath. So I really prefer my clients to have a lower pillow but tilt their bed up at the end to be on that angle for better breathing. Okay, so if we roll Amber onto her back, so can I just get you to roll onto your back, Amber? So we can see now, looking side on, that really the head is way too far forwards in front of the body. So it's kind of like having your head in this front position. Now we've talked about this in one of our earlier videos, looking at posture and sitting, and also looking at retraction neck exercises. It's really, having your head in that really forward position is a position you don't want to spend a lot of time in. So now let's take the pillow away. So that's really scooting the spine up in this direction. So now let's take the pillow away. And we're bringing Amber back down onto this normal pillow. And you can see now the head is a little bit off the bed, but because of the dip, the neck is getting support and the head is actually, you know, only 1.5 inches really off the bed. So that's actually not too bad. That's actually not a bad position for most people. If your spine was really super flat and you didn't have that sort of normal thoracic kyphosis or thoracic curve, then if your back was really flat, then having no pillow sometimes actually can be more comfortable if you're a back sleeper. But for most of us, no pillow even in back sleeping is a little bit too much pressure. So let's have a little look at that. So Amber actually doesn't look too bad with no pillow, but you can still see now that the chin has tilted up a little bit. So what's happening there is that the head is tilting up like this to kind of be in a comfortable position. And I think that's going to put a lot of pressure in those top joints of the neck. So we want to avoid that as well. So I think even for Amber, who is pretty mobile, I think in her spine, even for her, having a pillow if she was a back sleeper would probably be a good thing. So let's put it back and just take one more look at that. So now with the pillow you can see she's getting that bit more support here and her head's a little bit off the bed. She could, if she was a back sleeper, I'd actually suggest that her pillow was slightly lower than this. I think this is the perfect pillow for her for lying on her side, and probably while it's good for back, it's probably not the perfect one. So you can see that gives you a bit of a rundown today on really all of the factors to take into account when you're checking out a pillow and trying to match the right pillow, the right height, the right contours as well with the right person. We actually do stock some pillows that are adjustable, and I think we're going to do a video on one of those because I think that the beauty of those is that you really can modify it for you, and if things change, you can change the position. Whereas with these latex pillows, once you've got that pillow, if that you're sort of stuck with that contour. If you change or if something happens, you can't really change the pillow. And often if you buy them, you can't return them, and that's a big problem because they're not adjustable. Yeah. So hopefully that gives you enough pointers. I'd recommend start off by going home, getting your pillow and putting it under your head and actually getting someone to sort of map out where your spine is, or putting that mirror in front of you so that you can see where your spine is in space, and then you'll be able to tell if you're starting from a good place or a bad place. Thanks for your time, and if you need any more help with your pillow adjustment or picking the right pillow, please come and see one of our physios soon.